Hello, guys. Welcome back to the podcast. It is your host, Maeve, here today. I am flying solo with our fantastic guest. We have been so excited and so keen to have her on the podcast and share her knowledge. It is Jamie from J3U Coaching. She's a women's physique competitor over in the US. And she is going to talk to us today about all things HRT and birth control related. So we know you're going to get so much from this episode, and it's one we've really wanted to do for a while. Jamie, do you want to just give a little quick hello and intro about yourself?
Yeah, hey, I'm super excited to be invited to talk about all of this. Very passionate about female hormones and birth control and just educating because I feel like we just don't know enough as females, um, even
Yeah.
about our own bodies, right? And I think that once you enter into the scenario of contest prep or the world of bodybuilding, it becomes even more important that we have an understanding of how our body operates and also just why we're doing what we're doing, and so that we can just make more informed decisions about um, how to make progress,
Yeah.
right? So, I mean, one of the biggest things for us is we want a better physique. And so, if we don't have an understanding of like birth control or say HRT, then it's things that are being left on the table for where we can pull progress out.
100%. 100%. And like, we're just all about educating, empowering, and allowing people to make those more informed decisions about their physique and their bodybuilding journey. So yeah, we definitely want to get straight into this. We did have a few questions sent through from listeners, so we can. I guess we'll just start off on the HRT front because I think while it's definitely still not talked about enough, it's kind of getting a little bit more traction now. I think people are getting a little bit more clued in. There's definitely a little bit more ladies open to exploring that avenue and kind of, just taking more of an interest in their hormonal health, which is amazing. Um, what would you say maybe are some of the big signs and symptoms like that a lot of women may experience and kind of downplay because that's what we do, and that they maybe should take more note of and kind of, maybe look into testing and exploring that HRT avenue?
So if we're gonna just talk across the board about contest prep situations, so I think that so if someone hasn't ever competed, or for people who have competed, it's like 99% of all females are going to have a downregulation of endogenous hormones during a contest prep situation, or even just like a being in a caloric deficit, say, or just in a dieting phase, right? And then in a contest prep, we're going to go into even more extreme than say prepping for a photo shoot,
Mhm.
right? And so I think that it's one of the biggest things is that I'm just going to say, like, are you getting blood work done? And yes, of course, we have to go. There are a number of variables we have to look at, like we have to look at biofeedback, and how we're feeling. But at the same time, it is important to have full comprehensive blood work done with specific markers at specific times of the month. So if you have a female who still menstruates and has what is a normal menstrual cycle for them, because of course it's going to differ for everyone, um, then having your blood work done on like the right time of your cycle so that you can have um, so that we can see where your baseline hormones are sitting, right? So um, with HRT, I think one of the things is women often are hesitant about it because they think automatically it would be testosterone, and it
Yeah.
isn't always testosterone.
Yeah.
Right. So bioidentical hormone replacement therapy can be thyroid, it can be progesterone, it can be estrogen, it can be DHEA, it can be testosterone as well. So it's like, it's not like as soon as you decide that you want to find out about HRT that you're automatically going to be on TRT. like
Yeah.
testosterone
Yeah.
replacement, right? So it's just hormone replacement is the replacement of endogenous hormones. So it doesn't mean that it's testosterone or an androgen, right?
Right.
So, and then, so some things to look for. So if we are going to talk about contest prep or competitors, then we're going to see likely with thyroid hormone, like if it's a thyroid hormone issue, then it's going to be say that there's hair loss or cold all of the time, or constipation, or brain fog, or problems with hunger signaling, with weight gain too, or not being able to lose weight even in a caloric deficit. One of the biggest things that I see now is early perimenopause. So we have different phases that we go through as females. Perimenopause is, of course, that period of time where we start to see less ovulation, and we have fewer eggs. And then our progesterone starts to decline. Often estrogen does as well, and usually testosterone, right? And so perimenopause, though, what I've been seeing is it's been happening a lot younger,
Yeah.
and especially in people who have been in contest prep where they have gone to extremes with like dieting and energy expenditure, and then also say they were enhanced, with using large amounts of anabolics, and not having a good baseline set of hormones first before they did all of that, or had anything to or used anything to supplement them while they were in contest prep. So perimenopause often we'll see a decrease in progesterone. So
Mhm.
with a decrease in progesterone, often what will happen is it means that our estrogen to progesterone ratio is off. So estrogen will be too high. So then we'll start to see, signs of, say, I don't want to call it estrogen dominance, but so we'll have heavier periods so that they last longer, and to the point where some females can't leave the house because their cycle is so heavy. And what progesterone does is it helps to thin the uterine lining. So if you don't have progesterone, I mean, that's one of the things. I mean, we could go off on a
Mhm.
tangent about all the benefits of progesterone, but with not having progesterone, then that would mean that your uterine lining almost overgrows. So there's nothing to stop it, and then that's what would cause like the heavy cycles,
Super
heavy
heavy.
periods,
Yeah.
right? Usually anemic because of the blood loss, and then
Mhm.
that directly affects thyroid as well. So we'll see things with like heavy periods, and then also sleep will completely go out the window, and there'll be like hot flashes at night, and sleep will be completely disrupted because progesterone is what helps us sleep. Progesterone is the thing that eases anxiety as well. It's like the feel good hormone. And so if you don't have progesterone, then most females will have high anxiety as well. So there's a bunch of fun stuff in there.
Great. Um, so with the different types of products, yeah, that's so interesting because I do think when you talk about HRT in general, females automatically are like, oh my God, I'm not taking testosterone, but they don't actually realize there's so many other hormones that can start to dip, especially during that contest prep. So with the kind of early onset perimenopause, because it's definitely something you do see highlighted a lot lately, are athletes and like female competitors who are down the assisted route, like would you see that more commonly in them, like it coming earlier for them, maybe if they're not looking after supplementation or whatever that may be during a prep, like would you see that kind of happening more with them?
Well, I mean, so usually just in a contest prep, we'll see most females are going to lose their menstrual cycle, right? So with that, most females will have a complete downregulation of estrogen, as opposed to like say the opposite of like progesterone and estrogen. But and then thyroid hormones will also decline in contest prep. So um and then the thing is that's usually where we'll see people struggle with the final phases of fat loss,
Yeah.
um and And so that combine that with also causing like really low levels of energy from having thyroid hormone that has declined means that, then you have less energy expenditure because you can't, because you're so tired that you can't do anything, right?
Hmm.
So you have this low level, and then what is your post show going to look like? So if your levels already weren't great, so let's say you enter a contest prep and you haven't done blood work and your baseline hormone environment also already isn't fantastic, and then you go into prep, it declines even further. What is your post show going to be like? So how are you gonna pull yourself from out of that hole that you've dug yourself,
Hmm.
right? And so with having that's where we see women struggle a lot with one,
Yeah.
they can't get conditioning for stage.
Hmm.
And then post show is an absolute disaster with lots of usually with weight gain, right? Um, and then it's like, so if we don't have any testosterone, we don't have estrogen, we don't have progesterone, thyroid hormones are down, then how do we progress in order to change our physique if we've gotten feedback to say, hey, do this, you need bigger glutes, you need bigger shoulders, you need this, blah, blah, blah. Then what? And you see like you'll see um, competitors that just don't ever improve.
Yeah. Yeah. And they're probably just not paying attention enough to those. Yeah.
or
We-
or they can't compete for very long. Like their longevity in sport is very, very short
yeah.
because they have completely tanked their hormone environment.
Yeah. And you just feel like, so you're not going into that situation again.
And I
Um,
think one of the other misconceptions about HRT is about that it's there to make you super physiological, which it is not,
yeah. It's bringing it back
right?
to the baseline rather than, yeah.
Yeah. So, and if we look at lab values, which I know in every country, every lab value is a different value. We all
Mhm.
use different measurements. I wish we could just use the same ones across the world. It would be so much easier, so I don't have to convert everything when I look at labs. Um, but so when we look at like at values, so Gen Pop values are a little bit different, right? So you get blood work done, and then if you go to a primary care GP and they look at your labs and they're like, "Oh, you're good, you're in range."
Which they do.
What
Yeah.
and this is what they do. So it's like so for females for testosterone, um, we are um, I'm trying to remember what value we use in Canada. In the States, it's nanograms per deciliter for testosterone for females, which is 0
Okay.
to 45. That's Gen
Okay.
Pop, 0 to 45. Even if you're at 0, they're still like, you're in range.
It's a big range.
Yeah, it's a big
Yeah.
range. So for physique-based athletes, though, and of course, depending on level of muscularity required for your division, we like women to sit 45 or higher, but no higher than 100.
Yeah.
That is considered super physiological in a Gen Pop value in the range, right? And of course, it's like the other thing with HRT is it's like if you have blood work done and yes, you're low, and they decide, you know what, yes, you need testosterone and you need progesterone. Say you don't need estrogen or thyroid medication. Sometimes it can take 10 to 12 weeks to figure out the proper level for you.
Hmm.
So, so say your testosterone is low, it's on the low end and it needs to be brought up. Um, One of the biggest things is like you start at a low amount and you titrate up according to need. And
Yeah.
when I'm talking about titrating up at a low dose, it's like 3 milligrams for females per week.
Yeah.
So you would say you would start at the lowest amount, so say 3 milligrams. And this is where it's important to go to an HRT clinic because they can compound female test at like 20 milligrams per mil.
Yeah.
Because if it's like, if I'm going to, if I decide, oh, well, my levels are low, I'm just going to self-administer. That means that I'm going to be using my boyfriend's or my husband's
Mhm.
testosterone that is compounded at 250 milligrams per mil. Tell me how you're going to dose 3 milligrams a week. You can't, you
Yeah, you
can't.
can. Yeah, you can.
So after you would start, like say the 3 milligrams, 6 to 8 weeks following is where you're going to have blood work redone to see what that level where it puts you.
Mhm.
If you feel great and your level is higher, then that would be like, okay, cool. Then this is
Okay.
where I'm going to sit. If it still doesn't bring it up very much and you're still feeling like kind of like blah, then that would mean that we would titrate up to 5. From there, it's usually we go to 8. Some women need 10,
Oh, wow.
some women need 15.
Yeah,
Remember that it's we all metabolize differently,
yeah,
right? So it's a very individual thing, and it can take time to figure out where your dosing needs to be for you. So it's not like you go and you're like, oh yeah, I got my meds. Next week I'm gonna be like Superwoman.
thanks. Yeah,
So it's like you have to have patience with it because it can take some time just to figure out what levels are going to work the best for you,
yeah.
right? So
Mm.
that, I think that that's like um it's and most HRT clinics they're like they even will say like we are not here to dose you super physiological.
Fair. With the clinics, because I know that this can be a bit of a struggle, especially when you are not over 40 as a female. Like, it can be quite a battle to for someone to even listen to you. I know that's definitely the case in Ireland. Like, I I had blood done here. The doctor was like, "You're fine." I was like, They are not fine. Like that, those levels are not fine." Tried to get in when I was at home with the HRT clinic in Ireland, and they literally laughed on the phone. They're like, "You're 30, like fuck off, basically. We're not even entertaining
Yeah.
you. You're not a menopause." And I was like, Jesus, it's so difficult to actually get somebody who is willing to kind of bring you along on that process when you are that bit younger? Like, is there anything you can do or say in those situations?
So I mean, I know in the United States it's a bit easier because there are clinics who work with bodybuilders. So they
Yeah,
view people very differently and they understand the needs that during off season, your needs are going to be different than in a contest prep or a post show um, situation. So they'll titrate your meds up if need be, like with T3, T4. You might just need testosterone during contest prep, or you might just need estrogen during contest prep too. So
yeah,
they're pretty good about that. That is one of the biggest issues though, because like even in Canada, it's really hard.
yeah.
Except for so with HRT clinics though, if you have a good clinic, you can they will often treat symptoms as opposed to lab values.
Okay. Yeah, yeah. So if you're
So,
depressed and no energy and stuff, they're more than likely, okay, we'll help you out. Yeah.
and I think
Um,
what it is it's having the education to be able to advocate for yourself.
big time. Big time.
So around testosterone, right? So if say you get labs done and your testosterone is like on the really on the low end, which honestly most females are, you can I mean basically you go into you would find every single symptom of having low testosterone
And
and you
take it
would
off.
just tell them that that's what's happening, right?
Yeah.
So it's like my recovery in the gym is really bad. My sleep is off. I feel depressed. I'm getting weight gain through my midsection. My libido is tanked. Like all of
Yeah.
those things, right?
Yeah.
And all of that is, if it's an HRT clinic, then they should be listening to you according to like what your symptoms are, as opposed to like, oh, well, you're within range.
Yeah. Got it.
Yeah.
With the post-show kind of period, is there like a maximum kind of, let's say, grace period you would give us to allow levels to maybe come back to normal before you're like, okay, no, we absolutely need to go down this HRT avenue?
Well, for most people, like if they were with me, they'd already have it in play during contest prep, right? To so that it isn't as negative post show for them. So
Yeah.
then what happens is post show, it's like, okay, now cardio is going to decrease, training is still going to be somewhat like on the lower end of volume. And right away, I bring their food up almost immediately. There's no slow, it's not slow. We want to get that person out of the like emergency as quickly as possible.
Yeah.
So, so thyroid meds will stay in. Um, Test this, like if they are TRT, then test will stay in. And likely with the food, with the sleep getting better, with everything, it's like we always get labs redone around 8 weeks anyways, post show. And then at
Mhm.
that point, it's like we look at levels and go, oh,
Okay.
okay. If their thyroid meds were titrated up in prep, which normally happens like towards the end, then what we'll do is we'll slowly bring them down to their regular dose if they were on thyroid medication, if they're just on that year round.
Got it. Got it.
But if it's only added in contest prep, then we will slowly titrate them out of it.
Yeah.
Yeah.
Um, there was a question around weight gain and HRT, and just someone curious, like, would it be something that you notice, or is it more so you respond better when it's in play because you've maybe struggled without it? Yeah.
Yeah. I mean, for the majority of people, having hormones in a good place will make it easier to maintain lean body mass without body composition going in the wrong direction,
Yeah.
right? So
Yeah.
so yeah, that's it's like too much estrogen, um, and there you'll usually have like people who will have weight gain without progesterone. If you don't have estrogen and you have too
Yeah.
much progesterone, it's the same
Yeah.
thing. Usually there's weight gain. So, and then if you have too much testosterone for females too, usually you don't have weight gain, but you'll usually just feel like terrible.
Yeah.
So
Got it.
it's finding that
Um,
balance amongst the three of them.
yeah, so
Yeah.
basically when the ratios in any form are off, yeah, that's when the kind of negatives come from it. But once that's supplemented in and levels are where they need to be, then yeah, you shouldn't get any of that. I know some people are probably still reluctant on the testosterone end of things. So even though we're not bringing it to a super logical kind of level, are there any negative side effects or anything that will come from it, just to put people's minds at ease?
Well, I mean, it's an androgen.
Yeah,
So therefore, if your levels are too high, it would be no different than
yeah,
adding like an anabolic in at a higher level so that there would be signs of virilization, right?
yeah,
Um, and of course, having too high of testosterone can cause, there can be some issues with hematocrit, right? So the higher the androgen, so you would see it in labs with higher with hematocrit being off, and then also with lipids. So you'd see some skewing in lipids when testosterone is higher than it should be, right?
yeah,
Um, and it's the thing is like with any with having higher level of androgens as a female, you just need to be informed to know what to look for signs of virilization.
yeah,
It's something that we just need to know. So if it's like, and it's going to be different for everyone. So it could be like they start getting like more facial hair.
yeah,
And that would mean that likely your test level is too high. If we're talking just using testosterone, right? Then
yeah,
it could be too high. And I've seen a lot of HRT clinics and like just because it's an HRT clinic doesn't mean they always know what they're doing either.
Mm.
Dosing females way too high, like 20 milligrams a week.
Ooh. Right.
And that's 20 milligrams a week is where a female would be for transgender, for like for transition.
Okay, right, okay. So
Yeah.
definitely too
So
high.
that's why it's also good to be informed. So just because it's an HRT clinic,
Yeah, do your
sometimes
research. Yeah.
times with testosterone replacement therapy in females, it's still very antiquated. And it's they don't understand, right?
Mhm.
And so that's why it's like if your doctor out of the gates prescribes 20 milligrams per week, you're like, nope, I
Mhm.
actually would prefer to start like way down here. Because
Yeah,
as females, we are very sensitive to androgens. So,
yeah.
right?
And especially then if somebody has other androgens at play, like you you really don't want to yeah, overdo it.
Yeah,
Yeah,
because that testosterone that you're taking weekly is included in your weekly androgen total.
yeah.
It's still an androgen load,
Mhm.
right? And for some females, it's like if it's say like say they have other stuff in play and their total is they're sitting at 100 milligrams a week of a different androgen, and then you also add 10 milligrams of test, that could be the tipping point. It could
Mhm.
be like it's just we don't know because it's an
Mhm.
individual thing, right?
Yeah,
So but that's why it's always you figure out your baseline hormones first and find what amount of testosterone is going to put you at a good level, and then it's the other like other androgens that you would consider.
yeah, yeah.
Yeah.
So do your research, good reviewed HRT clinic, and do not touch your boyfriend's testosterone.
No, no, that's so, and I mean I can talk very openly about just with myself with my experience with TRT because so I'm 46, so I've been on TRT since I was 40.
Yeah,
6 years ago, there was no TRT for females, and if
yeah.
there was, it was gel.
Yes, yeah,
But you still couldn't, it was very, very rare. Um, and even at that point, competitors, like female competitors, that testosterone was like a like super taboo, like a note, like, oh my God, that's
yeah.
crazy that you're using testosterone. Um, and so I did have to use my partner's testosterone. Um, and it was a very, very small amount. And um, it was I mean, I was lucky because he's a paramedic. He's a firefighter
Okay,
paramedic. So
yeah,
so it was, and he had a lot of knowledge on anabolics and whatnot as well. So he drew it for me, but it was really tricky because, you think about insulin syringe, 200 milligrams per mil to try and get even 10 milligrams out of that. That's like two tiny little ticks in an insulin syringe.
yeah,
So it's figuring out like we would have to overdraw because if you only draw those two ticks out, then still some of it stays in the syringe. So then you're not really getting. So it was like overdrawing and making sure, like, talk about like
yeah,
ridiculous until I could actually have like fem test
yeah.
compounded in.
At least we have fem tests now.
Yeah.
Yeah, quick.
Yeah.
Yeah, no one wants to do that math. I guess we'll move on to birth control because
Yeah.
obviously an important one to talk about. Lots of different opinions and lots of different forms of that as well. And would you say there's maybe a form of birth control that is better than another, maybe one that's worse for sides or has more interactions?
So I don't want to, I never like to talk in absolutes about birth
Yeah,
control
sure,
because
yeah, yeah,
it's because of the fact that it's like, well, of course it was created for unwanted pregnancies, right? Some people that's just going to be their MO for to have to not have children is to use a hormonal birth
forever.
control.
Yeah,
But it is used in a clinical setting for other things to help people's quality of life, right? So it can be used for PCOS, right?
Yeah.
So for elevated androgens, so you have different kinds of PCOS. But if someone has like an androgen specific PCOS and their androgens are elevated, then birth control can be used for that, for insulin resistance, menstrual cycle dysfunction, acne. I know, like, I mean, it is used for not, I mean, I think there are other options for that, but like endometriosis, there are some females that it has to be used in order for them to function. Um, and then some people that have severe, like PMS symptoms.
Mm,
Um, but however, so in saying all that, I think now where HRT is starting to evolve, that is often now people are moving to that to deal with some of these issues as opposed to using synthetic hormones.
yeah.
So, um, so in the majority of females, though, like I think it's something like 70% or 75% of athletes basically are using hormonal birth control just to control their menses so that they don't bleed,
Mm, mm-hmm.
because it's a pain in the ass. And especially if you look at performance-based
Yeah.
athletes,
Yeah.
right? So you have like, say, like Olympic swimmers, or if you
Swimmers,
have
yeah.
like high level like Olympic weightlifters, or do you want to have like your cycle, you're traveling around the world and you're competing at that level, right?
Yeah.
Um, but then we have to look at just what, so if we're looking at like contest prep and bodybuilding, what it actually does. And so basically, depending on the type of birth control that you do use, hormonal birth control, it basically shuts down your endogenous creation of hormones, and you're just replacing them with a synthetic hormone, right? So there's like feedback inhibition. So there's reduction of like follicle, stimulating hormone and luteinizing hormone. So signaling to ovaries. So with LH reduction, you get, estrogen, no estrogen is being produced. And then with the reduction in FSH, it means that there's no follicle so developed. That
Yeah.
follicle development is, that's where we have progesterone, which helps us feel better. And and there's benefits to both hormones, estrogen and progesterone, right? But then there's no egg release, so you don't actually ovulate. And often women think that ovulation is just for fertility and for conception. Ovulation is a health marker for us.
Yeah.
So, um, and then if you, look at like a progestin based, it increases cervical mucus. So that's kind of how they will work. There's, that's a progestin base, so say an injection or so
Or
like
like an implant.
Depo-Provera, or a, or like an oral progestin pill. And then there's hormonal IUDs, so which is just a barrier. So there's the copper IUD, and then there's also, like the Mirena, a progestin
Marine.
based. Yeah, there's Mirena, Kylena, another one, Jades, I think is another one. What those do is they basically are just thin the lining of the uterus so
Yeah.
that you can't,
So
I
can't
mean, you
match.
can still ovulate. So you can still ovulate, but there's just, you can't conceive. Um, so birth controls are based on like synthetic estrogen and progestin together, so like a combo, or there's just a progestin only. The estrogen is ethinyl estradiol, I believe. And then the progestins, there are 4 different generations. So there's like a Gen 1, 2, 3, 4. The Gen 1 is like moderately androgenic. Um, Generation 2 is highly androgenic. Gen 3 is low androgenic, and then 4 is anti-androgen. So that's like, drospirenone. I don't know if you've heard of like drospirenone before.
No.
So, and then there's also all these different delivery phases. So there's monophasic, there's diphasic, there's triphasic, there's quadriphasic. The most popular one is a triphasic, and that is like there's an, so the EE, or the, ethinyl estradiol spikes mid-cycle, and then progesterone spikes twice. So it's 3 different phases. The mono and the tri actually are used, um, those two are the most common. And then it's like you have like the on and off. So there's 21 days of this of the hormone and then 7 days off with just like the sugar pill.
Mhm.
Some of them are 24 on and 4 off, and they're trying to minimize like hormonal swings. Um, but really that withdrawal period, so people will be like, oh, well, at the 7 days, it's fine because I get my period. It's just a withdrawal bleed. It's not an actual period, right?
Yeah.
So lots of women just will carry through. They don't
Yeah.
take that, continue the hormones, right? Um, and so there's like, well, I think that, I mean, I've kind of made it clear that like the endogenous hormones or the exogenous hormones do not work the same as our endogenous hormones. So external, internal, like the synthetic as opposed to our own. So like a progestin, yes, while it, like people say, well, it's still progesterone, but it actually isn't, and it doesn't have the positive progesterone effect. Um, and then we have like, so we're talking about the progesterones, how there are four, or the progestins, how there's four different generations. So with those four generations, it's just their off-site action is different. So when we say that they're like androgenic, they can bind differently to different receptors. So progestins like off-site, so if it's like a synthetic progestin, then that means that there can be like water retention, cortisol increase, which causes catabolism. There's elevated oxidative stress. Insulin resistance is another one too that can happen. And then it also affects testosterone, right? So all hormonal forms impact testosterone levels with like a pretty big potential to impact training performance.
Mhm.
So there's hypertrophy adaptations and like strength gain, affects strength gain and then fat loss. So with lowered LH and FSH, that means that it decreases your testosterone and your DHEA. So that means that you have increased sex hormone binding globulin. So um, it also is like the way it's metabolized. So there are certain ones that it's like first pass through the liver too. Um,
Mhm.
so it, um, and then there's like combined oral birth control reduces testosterone, free testosterone, DHEA and there's like a Zimmerman, um, it's a literature, Zimmerman, I think is 2014, and it reduces that by 50%. So
Wow.
that's pretty big for, especially you have females who we already don't have a lot of testosterone, and then now we're reducing it again by 50%.
Yeah, and I would imagine, like, especially when you're younger, you're jumping on it because you don't want to be pregnant, right? So you've been taking this birth control for years and years and years, and then you start competing, and maybe you haven't considered shit. Where are my internal environments actually at? Yeah, so I think that's a really interesting one.
Like things like the patch and the depot shot, it basically tanks your estrogen, and estrogen is anabolic. So
Mm-hmm,
estrogen supports anabolism. Um, it also supports fat loss,
mm-hmm.
right? And then in turn, it also decreases protein synthesis rates in within exercise. So
Great.
um, yeah, I mean, there's a lot of negative effects. It also like leaches a lot of minerals from us. So if you're using birth control, then there are a plethora of supplements that need to be on board to
Yeah, that's
replace
what I
what
was
is
gonna ask
leaking
you.
from taking them. And that a lot of that has to come with comes with the fact that we aren't ovulating.
Mm-hmm,
So which decreases like bone density, and
mm-hmm.
it's decreases and it's like um it's it's like estrogen is like neuroprotective, it's renal protective, it's like there's so many benefits to all of those hormones, and so then you take them away, and then you put a synthetic one which doesn't, it's
It's
just
not
not
the
the
same.
same.
It's not the
So
same.
it's like so it's so there's like folic acid, riboflavin, so like all your B vitamins, so your B2, your B6, your B12, vitamin C. Minerals is like magnesium, zinc, selenium.
Hmm.
There's like, there are a lot of extras that you need to be taking if you have birth control on board. Um, there's actually like a study that I pulled up too. Um, it's like the administration of oral contraceptives on the synthesis and breakdown of myofibrilloproteins in young women. Um, and so with this one, it's like the third generation, they had lower, um, because there was a few different ones. This is one to definitely like check out. It's Hanson 2011. And it just there's like a third generation, they did a third generation, a second generation, a non-birth control group tested in like follicular phase. There's a trained and not sedentary, which is an important one. And it was like a leg kicking exercise. They tested protein synthesis rate 24 hours after the exercise.
Yeah.
Um, and so the third generation was lower than control, the second generation was higher. So the third generation is low androgen, the second generation is high androgen, and then the third generation was and control weren't different at all. So that there's no difference in muscle protein breakdown, but there's potential inhibitory component on anabolic hormones. And there was
Okay.
lower free test in all of the birth control groups.
Okay. I'll definitely pull that up and link it in the show notes for anyone who wants to take a
Yeah,
deep
I
dive.
mean, and that's like one of the things that we always try to back with saying like this is not great. So, but why isn't it great? And we have literature to back that up to show that it actually is causing issues, not just because of a bias, because we think that, birth control is not great, right?
Yeah.
Like I said,
Um.
it's it can help some people. So,
Yeah, for sure. Do you think or is it something that you do? Like when I started getting into competing, it was like a lot of coaches were like, "Come off the pill! Like you're not taking that during prep." And can you talk a little bit about like if the pill or various different birth control options have any extra effects during your prep, or if you're assisted, is there any interactions or anything like that?
so I do have a list I made of what ones like the recommendation selection. We can just kind of talk about that. Um, So the progestin onlys are the least ideal. So they decrease all of your endogenous hormones. So that would mean that it would hinder fat loss and muscle gain process, right? So this is least to most ideal. Then we would move to like combined estrogen and progestin, monophasic over triphasic. And there's some evidence to show that it impairs aerobic capacity in luteal phase, and there's more fat gain if you use a triphasic because
Okay.
of it's the estrogen and then the progestin. So there's two spikes. Um, and then there's the oral over the patch or the ring because they might be more impactful on sex hormone binding globulin. And the hormonal IUD would be third choice. So that would be like the Marina, the Kylina, the what JDES is the other one. So those ones, I mean, they're placed for 5 years or 3 years. I think there's a
Yeah.
difference. The difference between them is I think Kylina has less progestin in it, and then I think that the JDES is made for women who have not had children, so that the IUD is a different shape so that it fits in their cervix. I think that's why. And then the copper IUD is the most recommended because it doesn't have hormones.
Yeah. So you're
But
not.
there some women can definitely have negative sides, so it can cause heavier bleeding.
Okay.
But yeah.
Would you
But
say
I
maybe?
remember all of these too, with like the non-hormonal birth control or like the copper IUD. All of these too, before you choose any of these, you should be having blood work done anyways.
Yeah, got it. So,
And then, of course, the first choice is going to be vasectomy. Um, and then just like condoms or, other kinds of non-hormonal birth control,
yeah,
right?
cool.
Um, I mean, the
So
other ones that lots of women do is they track their temperature, they track their
yeah,
ovulation.
yeah.
So that's
Okay.
the
But there probably are, and I would imagine a lot of people in the sport that definitely don't want to risk it. So yeah, we just wanted to definitely cover to see what the best options are to explore. So things like the Implanon, like progestin only, maybe bottom of the list, and then look towards something like the copper coil. Cool. Amazing. And why do you think that the negative effects of birth control maybe aren't discussed as much?
well, I think for one, it's been just a socially accepted form of medication for so long that I mean, women haven't been educated about their menstrual cycle in the first place.
Hmm.
It's really strange because I think that it's still very taboo
Yeah,
almost to educate women about just the phases of their menstrual cycle and why ovulation is important and just all of those things, right? And so one of the biggest things about birth control is it's introduced to us as a female at a very young age um, as a way to get away from having a period that we've been told is a pain in the ass.
yeah,
We're not educated to like, yes, we're told like, okay, well, now that you have your period, you can get pregnant.
yeah,
Like
yeah.
that's, and you're
Ah! Yeah,
and you're likely gonna have cramps and you're likely gonna like not feel good and you probably get headaches and you're gonna
yeah,
feel bloated and you're gonna have cravings and it's like we're told all of those things, but we aren't really told the like the purpose also of having a menstrual cycle and ovulation outside of just conceiving.
yeah,
And so I think that that's why it's like um it's easier to just stick your head in the sand
yeah,
instead of learning about your body. And I mean, if you think about it, if you've been on birth control for a long time, going from not really having a cycle, not having to track it, not have headaches, possibly not have acne, all of those things,
yeah,
right? To okay, well now I'm going to go off birth control and I'm going to try and get my natural cycle back. But then once I get it back, and I'm going to have to do all these things to get it back, then I'm going to have to track it every month with an app. And if things change, then I'm going to have to try and figure out why it's changed. And also it's like, and then what feminine hygiene products am I going to use?
it's a
And it's
lot.
like, so there's a lot that comes with it, right? And it's
Yeah,
like like I said, it's what's easier. What do people want? They want quick, they want easy, and it's like if
convenient.
I can just take a pill every month until you're in menopause and your bone density is that of an 85-year-old woman,
Mm-hmm.
or you've like a number of other like health issues
Yeah, because
from
I would
having
imagine,
synthetic hormones and
yeah.
not ovulating.
Yeah, and there's so many people that, same as myself, like I would have taken the pill when I was 15 because I just didn't want to deal, and they were so sore, and I was crippled in school, and I'd have to go home, and I'd have to take codeine painkillers, and I'd have to, like all of the things. I was like, I'm not. That's just no. And then, I switched forms and stuff, but I would imagine there's a lot in the same boat that have just been on birth control since then and are now like, oh. Okay, it's probably time to, come off, or maybe they want to start having babies and that kind of stuff. So, is there any kind of like guidelines or considerations that you would say for someone who is maybe considering coming off birth control and trying to get that natural cycle back?
Yeah, so um, if you're deciding to come off, um, prepare to need some time for things to come back. Like I'm just gonna grab a book because I can show this book because this honestly, she is like you might know
Yeah,
who
I'll
she
link
is.
it.
So Lara Bryden,
Period repair manual.
Period Repair Manual, and then she also has a new book out called, I think it's called The Hormone Fix. I think. Um, this is if you want to know how to come off birth control and deal with it and what to expect. She is fantastic. But okay, if we look at why would you want to come off? So you're gonna have better mood, energy, because it affects your serotonin and your dopamine.
Mm-hmm.
Um, well, ovulation is a vital sign of health, so metabolism is going to be better, bone health too. Um, Estrogen increases, um, insulin sensitivity, IGF-1, progesterone improves your sleep and your thyroid function.
Mm-hmm.
So there's improved muscle building and fat loss capacity, hair protective, skin protective, vaginal protective, because that's another one. So you have a lot of females who are on birth control that one, they have no libido, and
Yeah.
two, they actually have it's like vaginal atrophy,
Mm-hmm.
neuroprotective, bone protective. The issues stopping. So there can a lot can pop up. So post pill acne. So your like birth control suppresses sebum production, and as soon as you come off, then usually it's like now you're
Mm.
yeah.
Yeah.
So you usually will end up with a lot of acne post because your hormones are like right, like they're
Mm.
like what the heck do I do? Post pill PMS. So remember you're doing this for hormones, and then there's post pill amenorrhea.
Okay.
So likely you won't have a cycle. So then you'll go through using over-the-counter supplements, usually like Vitex, Chaseberry, to try and get back with omegas, selenium, a number of other over-the-counter supplements, making sure that you have enough dietary fat, that you're not over-exercising, that you're prioritizing sleep, eating the rainbow for micronutrients. And then there are some women who will have post-pill PCOS.
Oh,
So
okay.
that's also something that can pop up, right? And it's caused from withdrawal of synthetic estrogen and then a surge in androgen. Um, and then return, like it's just like the return of normal periods can take some time. And then delay in ovulatory periods as well. So it's like, say someone's wanting to stop for fertility, right? You have to restart all of that. Um, and then and in the beginning you likely will have a decrease in your mood and energy, so it's one of those things where it's like you have to be prepared. It's not like all of a sudden it's not just going to be like magic. It takes some
Yeah.
time and it takes dedication in order to do it.
Yeah. Would you say there's a best time, like phase to do it in? Like of the year, how long before prep or how long after prep, and you're in off season, like
Off season is the
ideally.
best.
Yeah.
um, yeah, so you need to have to be not in a stress state.
Mm-hmm.
um, and then because stress is a major contributor for LH and FSH function. And then contest prep and post show, not ideal.
Yeah.
You want to do it in an improvement season,
Yeah.
um, or like a holding phase, because then you can bring your total stress load down because your food's going to come down a bit in a holding phase, and also your training volume's going to come down too. Um, but it's things like adding in, so there's melatonin, NAC, um, carnitine. So actually, like injectable
Mm-hmm.
L-carnitine is one,
Mm-hmm.
um, and then chaseberry or Vitex is another one. And then there's progesterone cream. So sometimes you can kickstart things with using like hormone replacement progesterone. DHEA has been used, and then boron. So boron is helps to for with your natural production of testosterone. Um, and then just like lifestyle is going to be stress management and sleep routine. But like I said, like the food thing too, right? Um, and you might end up with gut issues. Like there's a plethora of things that can happen if you've been on this. So, um, like gut health can be off, thyroid health can be off, food sensitivities can pop up. Um, and then there's like, you would also want to make sure that you're taking omegas for inflammation.
Mm-hmm.
Metformin would be a good one to have in play. Some sort of curcumin-based supplement. And then, of course, having like zinc in there, vitamin
Yeah.
D, which we should have in anyways.
Yeah.
Make sure that you have ferritin because if you do have your cycle back and it's irregular, you might be bleeding more often, and so you might be somewhat iron
Mm.
depleted from that. And then there's also like histamine intolerance that can happen with it because of gut issues. And that's like B6, or you can use like a DAO enzyme. And then there's selenium, which you can also get from like Brazil nuts.
Yeah.
So it's a process and you have to be committed to it. So you need to have a good period of time.
Yeah. Warning signs around the house, partners beware. Yeah.
Um,
Okay.
and just with like birth control and PEDS. So if we want to talk about like PEDS and birth control, so with PEDS, we're suppressing the HPO axis, the hypothalamus
Mhm.
pituitary ovarian axis, right? Axis. So higher PED, higher stress. With birth control, it's like there's like further suppression. So, and the other thing too is like if you were to use an anti-androgen birth control, like the fourth generation, which is the drospirenone, it may lessen the effects of PEDS because it's an anti-androgen. So even like
Right.
Spiro, Spiro is another one that is given for acne,
Mhm.
to reduce androgens. But then if you're on PEDS, then it's like it can lessen the
Yeah.
effects of PEDS. Um, so and there's like same with like we want to have estrogen in play too. So we need to have activity with estrogen. And like we talked about before, it was like hair, skin, um, with like vaginal atrophy, neuroprotective bone density, all of those things. So it's like so you already have something synthetic hormones that are in play that are suppressing the HPO, and then now you're going to add PEDs in because for most females, at eventually at some point in their push phase, they're going to lose their cycle,
Mhm. Mhm.
and that would be because of the HPO axis suppression. So now you got a double whammy in there.
The joys
And
of
if you're using like a first or a second generation progestin, then which are more androgenic, those may enhance side effects. So you might have higher chances of viralization as well.
yeah. So it's definitely one that requires a bit of research before pairing the choices together for sure.
And if I
Um
can get my like if I can get my females, if they're like, no, I still need to be on birth control, if I can get them to like move to one of the more preferred choices,
yeah.
there still can be some dysfunction following that.
As in switching birth control forms, you're still gonna so if you're coming
Especially
off, say, a hormonal one and then going to something like the copper coil, you're still gonna experience some, yeah, sides.
even with the going from the like the estrogen, the ethinyl estradiol and the progestin based, like the dual, and then you go just to like a marina, then there's likely going to be some rebounding there too that's going to have to be fixed.
Yeah. Okay. We could go down so many rabbit holes here, but I'm conscious of the time. I don't want to keep you up too late.
Oh
Um,
no, it's only 7 o'clock, and I'm like, I'm always good because it's like I'm very passionate about this stuff too. So it's like I want women to know, and it still surprises me. Like when I sit down with females and talk, and they're just like, I I didn't know that.
Had no idea. Yeah.
I had no idea. And I'm just like, I mean, I guess I take it for granted, maybe just the like the knowledge that I have, just but it's like I want females not only to know about it, but to prioritize their menstrual health.
That's the other thing, because you may know about it, but you still don't take it seriously enough sometimes, you know? Like,
And it's, I mean, there's a whole other tangent to go on around enhanced women and the shift in psychology around females that are enhanced.
mm-hmm,
Um, because I've experienced it myself. I mean, it's very, and my partner, he's very aware of how my personality will change, my psychology changes when I have a higher androgen load and just the decision making.
that's interesting.
So decision making changes with a higher androgen load. And we tend to at like with things like that, it's like you kind of look past it because what is the if your androgen load is higher, I honestly I think just the psychology of, well, the last thing we're thinking about is like is fertility.
Yeah, yeah,
And it's also it's like if when our androgen load is higher, there's very specific goals that we have in mind as an enhanced female, and it's like you overlook the things like that because that's just a pain in the ass.
yeah. Oh,
And I have this
absolutely.
other goal that I am going to achieve,
Yeah, and that's
right?
taking priority over, yeah, for sure.
And I mean, if you look at when we also have a higher androgen load, there we really don't feel very feminine. We're not in our feminine at
No, there's
all.
no feminine energy going on.
And I don't mean that we don't want to look feminine. Like
No.
it's very different. It's not like I want to like shave my head and look like a dude, right? And like I just mean that it's like we tend to run very masculine when our androgen load is higher. So it's almost like we don't want anything to get in our way of achieving those masculine goals that we
Yeah,
have, right?
yeah, because like, yeah, and just to be clear, we're talking about energies. We're not talking about how we're looking. Yeah, it's that kind of like leadership driven, like get shit done, bam, 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 rather than that kind of like caring, nurturing, yeah,
It's not a, yeah, it's all about doing, it's not about creating.
yeah,
And it's very robotic, right? It's
yeah,
like I just totally switch off into this like very robotic, very goal oriented. Nothing's gonna get in my way. I'm just like I'm gonna get shit done. Um, and and so it's very different when I'm in like improvement season and how it's like, oh, then I'm like I want to create more. Like I like painting and I like drawing and I'm like like I move far more into like the feminine um and then when I'm have when I'm in a push phase. So it's I think honestly that's why too is like um if you just if you're always constantly running a high androgen load too as a female, it's something that you lose sight of. And you don't we don't sometimes we don't view our health with a wide lens as females. um, and we don't think about the consequences that are going to happen when in our 50s or our 60s,
mm-hmm,
because all of what we do right now and like in our 20s 30s 40s, all of that can set us up for really crappy menopause and quality of life later,
yeah,
right? Can cause health issues later on. And for me, it's like I still want to be able to do all this stuff when I'm like in my 60s. So
yeah.
it's like um I just that's the thing that I try to get across to females is like if you don't prioritize this now, you're going to have some massive issues and cleanup to do later.
What are some of the not so nice things they will be dealing with in their 50s or 60s if it's not prioritized now.
Well, I mean, if you think about, like we were just talking about the importance of ovulation, right? So, and I don't have any literature to back this at all, but if you think about if we are at, so if we don't ovulate and we have a higher androgen load and we are our estrogen is diminished, um, then what does that do to us cardiovascularly later on in life? And then what about bone density as well? And then neurologically, what about Alzheimer's and dementia?
Mm,
So
yeah.
it's like it's those things, right? And do we want to be little frail old people um, because of the
Fall
things?
from grace. Fall from grace. Yeah.
Yeah, and I mean, and this is also where you have the discussion too about hormone replacement, which wasn't an option for females before.
Yeah.
And so that's where here's another visual about it too. And this isn't even just about like being older, like in your 60s, but if you historically, if you look at females in contest prep and then in improvement seasons, so you have they go into a contest prep season, right? And all of their hormones are like in the toilet. And then they come back up, probably not as high as they were before. And then it's like, okay, well, now let's do a push phase. And they jack up androgen loads up here for a very short period of time, right? Because our durations should be short. And then what do they do again? Then you're tanking
Yeah.
again. And then and then from there you kind of come back up, and then you go to contest prep and it's down.
Yeah.
So you throw something like HRT in there, which means that you pull your baseline up so that when you're in contest prep, your baseline stays good. When you're in improvement season and you're not in a push phase and you're a health phase, your baseline stays good. So that you're pulling progress out. Of course, you're not going to pull progress out in contest prep, but throughout like your off season, you're not doing these like, I feel
Yeah.
fantastic, I feel like shit. And then it
Yeah.
takes forever to get back up here, and then you're back down in the basement again.
Yeah.
Whereas it just like keeps you here. You have your push phase. You still have enough testosterone and baseline hormone so that you can progress even in like a health phase or like so. And a good example of this is last year for me, I went for 6 months with no peds, just food, just recovery, and just hormone replacement. So testosterone, progesterone, thyroid medication. Luke couldn't believe how much I grew. I didn't start peds until prep.
Wow.
And the difference between my stage photos was insane. And how much leaner I stayed and how much
Wow.
leaner and how much better my conditioning came in with
Yeah.
those baseline hormones in a good spot.
Yeah. So spend a little bit of time with them maintaining good levels before, yeah, pushing up androgens. Yeah, amazing. Thank you so much, Jamie. Like that was so much information, so much knowledge. People are gonna love this. I'm gonna link the study that you mentioned and the book that you mentioned as well in the show notes for people to go off and have a look at. Because I definitely think they'll be super helpful. And like you said, we just don't have the education there. Like you take it for granted as a coach and an educator that surely people know these basic things. They don't. It's just not out there. So that's exactly why we wanted to get you on and spread the word and just help educate people. We do have one question we ask everyone at the end of a show.
Oh
What is your death row meal?
my God, my death row meal.
Yeah.
Um, that's a good question. Um, I
Anything
think
you
it
want, anywhere you want.
honestly like a death row meal. I am like, it would probably be sushi, honestly.
You're the third person this week that said that.
Um, It has to be good sushi though. It can't
Oh
just be
yeah,
like
bougie shit.
super, yeah.
Yeah.
And then it would have to be like a really good piece of like the best cheesecake ever. Or creme brulee.
Oh, okay.
Really good creme brulee. Yeah.
Okay. Yeah,
Um,
I'm a cheesecake person for sure. Um, I know you have lots coming up with J3U, obviously the new prep coaching stuff has all
yeah.
begun and been launched. So do you want to tell people a little bit about that, like what's going on in the J3U world, the courses, the comp prep options, how to work with you?
Yeah, so we just launched J3U coaching. So I've been a coach with Luke Mueller with No Switch for a couple of years now. And this has kind of been in the background for a while. It's been like Luke and John have been working on it. So we just rolled out J3 coaching. And I think that there are 6 or 7 of us. I think we just added a couple more coaches. I'm the only female, so I am once again in the giant sausage party. It's just be myself with all the guys, which I'm used to. But so we just launched the coaching. We if you're interested in a consult, we have an onboarding process where you apply and you talk to Luke, and Luke finds the best coach for you, unless you have a specific coach in mind that you want to coach with. He basically takes you through the entire process though of how we coach, and we're pushing to change um, the standard of coaching within the industry, because as you know there's some really shitty coaching out there.
Yes, there is.
So it's really exciting. We have a lot that will be coming up with just coach education and podcasts and whatnot. It's only the first month that we've had it out, so we've it's kind of blown up.
I
Um,
mean,
J3 University. So we just if you guys don't know about J3 University, honestly, I think I was one of the first people to sign up when John launched it. I was one of his clients at the time. It has been the best thing that I have done for myself as a coach. So if you are a coach, I can't recommend it more. And if you are just wanting to coach yourself, the amount of information in there is it's there's so much information. So there's the applied hypertrophy optimization, which is all about training. We have the posing module in there now too with Daniel, which is for guys. We don't A female one is coming. So we did just hire a female posing coach as well. She just hasn't been announced yet. Um, there's the female module, which there isn't anywhere else that has the amount of information about females coaching females. What else do we have in there? And then there's level one. So level one is now we're launching level two. In order to do level two, you have to have done all of the rest of J3. And it is the thing with level two is it's applying the information. So it's going through, it's teaching you how to apply it to clients. Um, it'll be case studies and um, and it's more one-on-one with John and Luke. Um,
amazing.
More of a mentorship. So um, and yeah, what likely we're gonna have a recipe ebook coming out too. I think Renee and I are gonna work on that.
Oh, I love our recipes. That's awesome.
I know, so
Yeah.
awesome. So yeah, there's lots of stuff coming. I feel like we're just getting started, and it's gonna be a pretty
Yeah.
big year for us. So the one other thing I wanted to say, just touching on like education for peds for females, is
Yeah.
I want it to be that females are educating other females about peds, but
Yeah.
not from their experience.
Yeah.
You know what I'm saying?
Yeah.
So, someone talking about their experience with what drug worked best for them and the side effects that they got or didn't get is not a way to educate females or coaches that are coaching females on peds.
Yeah. 100%.
So, that's what we really want to be doing is teaching a foundation of making the best choices for females in on an individual base, what their specific needs are, not based on if Anavar felt good for someone else and they didn't realize from it.
Yeah. Yeah.
Because I find there's a lot of that coming out now is yes, women are stepping up and they're talking about it to because they're educating, but they're sharing experience, which is fine. I think
Yeah.
that it's good to share experiences, but that's kind of where that's definitely where we the direction that we want to go with educating.
Yeah, guys, if you haven't seen the course content, like it's phenomenal, absolutely unbelievable. So if you are a coach listening and you really want to up your game and, get yourself into the top level of coaches, I would definitely recommend checking it out. And especially if you are working with females or you are just a figure competitor or female competitor in general and want to understand the process that bit more, definitely check out that female module because it's incredible. I was looking at the content in it yesterday. It's
And if
unbelievable.
you can put the link into, and I actually have a
Yeah,
discount code for it too. So it's Jamie G10 if you want 10% off of any of the modules. You can just use that code.
amazing.
Um, and
That's great.
I do just consults too around like blood work or PED protocols or that. So, I mean, some people, well, I think you just did a post about this, about people saying that, oh, my training is fine, but
Oh, they're not. Yeah. I get that so much. I'm like, it's not fine. It's absolutely not
I feel
fine.
like we need to do 8 more podcasts because there's like
Yeah,
so many things.
let's do it.
Anyways, but yes, like there's some women that will come to me that I just do their lab work and give them recommendations on looking at labs. Um, so I've
Awesome.
had a few female pros that have come to me post show with labs, and
Yeah.
I've helped with that. And then just setting up drug protocols too, giving
But I also
insight.
think with the labs, like even for coaches, getting that real like good advice and guidance on labs on peds, like doing a consult like that is going to be invaluable. Like you're going to get so much from it and be able to ask questions that you're unsure where to get those answers from and that are reliable. So that's really cool.
Yeah.
Do you want
So
to tell people where to find you, Instagram, contact, all of that?
you can find me on Instagram. I'm still Jamie No Switch at
And Jamie will
Instagram.
not be switching.
And and then just the coaching. If you go to j3ucoaching.com, we all have a little, if you're wanting to reach out to coach with me, you can request me individually on that web page. And otherwise, you can shoot me an email. It's Jamie at j3ucoaching.com. And yeah, that's where you can find me. So if you want to know more about me, you can creep my page. There's some YouTube videos of me still on the No Switch Fitness page too, if you want to see me training.
Oh, yeah.
Um,
Yeah.
so yeah, and I work with males and I work with females too. So of course I like working with higher muscularity females. I
Yeah.
really like I love the process of showing females that how much they can if they want to work and they want to do WPD or bodybuilding. And of course, yes, I do. I love working with all females, but I yeah,
Yeah,
I
well,
like
that's what
working
we're
with
all about. So that's who's listening. That's exactly who's listening. Girls who want to get jacked and learn a lot in the
yeah,
process. Jamie, thank you so much again for all your
yes.
time. Like it's so appreciated and it was absolutely invaluable. Guys, thank you so much for
Very welcome.
listening. As always, please do give it a thumbs up, positive review, and consider sharing it over on your socials so you can help grow the listener community. We will be back again next week for another cracking episode. So we will see you then. Bye.